My name is Lauren. I'm from Michigan. I went to college at Michigan State University. I got a degree in kinesiology, and I found out about PrepMD from a friend in my major. She, nearing graduation, was going to go starting in May, and that's how I found out about it. She told me to look into it. And so she went, and then I ended up going in the fall of 2016. Since PrepMD, I work at a clinic in Chicago, a device clinic in Chicago. What I like the most about working there is I really like working with patients, and I really like the troubleshooting aspect of devices. You see something new every single day. You always have an experience, new experience, a challenging experience, and it's been very rewarding to work with all my coworkers, the other nurses, techs, physicians, device reps, kind of coming together, and everyone creates this great patient experience. And I think that that's my favorite part of the whole thing, is seeing something new every day, helping people. My education at PrepMD helped me at Northwestern. The remote training and just the device training, I felt like I already came in it with a really good background. And I work with one other tech and 3 other nurses. And then we run the clinic. We do all of the remotes and the clinic checks for the pacemakers and ICDs. And then we do remote checks for loop recorders. We also do all of the 1-week post-op checks and then 3-month post-op checks. And we do the OR pager. So we'll go down to surgeries when people are having a procedure to reprogram their device before and after. So you kind of get a good exposure in the hospital. You get to see other things aside from the device clinic, and you get to be put in new situations all the time with that too. So my experience at PrepMD really helped me kind of coming into that role already feeling like I had a good background in it. But I think even with the people that I work with who have been doing this for over 10 years, there's always something new that you can learn. But PrepMD definitely gave me a really solid foundation and a drive to learn more about all of those. We usually go down to the EP lab every day and just grab all of the sheets from the implants every day. And some days we have, 6, 10 implants every single day of these devices. And it's just a growing business, not only for the implanting side of it, but also for the follow-up for the remote. We have over 6,000 patients with pacemakers, ICDs, and loop recorders. So that's like a whole full day of clinic, and then also a full day of remotes and alerts. So from the rep side of it, they're always hiring new people just to keep up with the amount of the implants and then all of their different accounts all over the city. And from a clinic standpoint, we're always looking for more people who know devices too. And then Northwestern specifically is acquiring all these satellite locations. So each little clinic is kind of growing and growing. And we get new patients all the time. So it's always a booming industry.